Okay, let's get started with the respiratory system models. So let's get started with the head here. This is a mid-sagittal section head, and here we can see the frontal sinus right here. So here's your frontal sinus. Okay, next one we have sphenoidal sinus. Okay, right here we have the nares, or maybe going up through this way. Yeah, there we go. Next we have the paper. Next we have the nasal cavity. So we have the superior, middle, and inferior turbinate, or the superior, middle, and inferior concha. Hard palate or maxilla bone is right here, and then your soft palate is right here. This is the uvula, right here, and then we have the pharynx area. Let me zoom out. Okay, that's looking good. So here we have the nasal pharynx. Here we have the oral pharynx, and here we have the laryngeal pharynx. So nasal cavity and the nasal pharynx, oral pharynx, and laryngeal pharynx. Remember that during swallowing, the uvula will close off this nasal pharynx, prevent fluids and food from getting into the nasal cavity, and also this epiglottis is going to close off the laryngeal pharynx, thus preventing food and fluid from going into the trachea, as we see here. Okay, let's move on to the next thing here. So here we have the epiglottis right here. Remember that epiglottis is made up of elastic cartilage. And then we have the vestibular fold and vocal fold. So right here we have the vestibular fold. This is your vocal fold. This is hyaline cartilage associated with your larynx area. This is your trachea going further down inferiorly. This is your esophagus here. Alright, so we're finished with that one. So let's go on to the larynx model. Larynx model is sort of all the pieces here. Let me get this rubber band out of the way so we can look at some stuff. So, right here, if you put this together here, we can see sort of how it looks. Well, we'll just forget that. Well, pardon me. Now, so this right here is your ligamentum thyrohyroidium medianum. On the lateral part of it, we have the medianum thyrohyroidium laterale. Epiglottis is this structure right here. That's your epiglottis, made up of elastic cartilage. Here we see on the mid-sagittal section, we can see the epiglottis right here. On the other side, we can see the epiglottis right there. So epiglottis is right here. Okay, let's move on. We have the hyoid bone. So here's your, it's too bright. So hyoid bone is right here. This is your ligamentum thyrohyroidium medianum. That's your laterale. This is your thyroid gland right here. Your thyroid gland. And then we have the laryngeal prominence, or Adam's apple. It's this right here. And then we have the cricothyroid ligament, this right here. Get that clear. Yeah, there we go. And your next is your muscle. This is the cricothyroid muscle. or cricothyroideus muscle that you had to ID with your dissection back in 201. Cricothyroideus muscle or cricothyroid muscle. Next, we have the tracheal cartilage right here. That's hyaline cartilage. Okay? And let's see. We have the vocal fold. So, here's the vocal fold right here. Here is your false vocal fold, or false vocal cord, or vestibular fold. And then right here is your vocal fold or true vocal cord. So we have hyaline cartilage. We have hyaline cartilage that's going to be associated with the trachea, but there isn't going to be any hyaline cartilage here. This is the trachealis muscle right here. Trachealis muscle. It's going to be right next to your esophagus right here. Okay, let's move on to here. So right here you can pretty much see what I just said here. So we have the trachea right here. It's going down inferiorly. We have the bifurcation of trachea, primary bronchi here and here. And we have the, let's go over that again. So the trachea is right here, bifurcation of trachea, primary bronchi, and then we can see it forks off, comes a secondary bronchus, and then your tertiary bronchus here, and then segmental is here. So it gets smaller and smaller and smaller until you get into the bronchioles, the terminal bronchiole and the respiratory bronchiole, going into the alveolar sacs. Now, if you look at the lungs, we have, let me get these lungs out here. Let me set them on the table here. So, if you look right here, well, let me just, okay, you can see that. So we have the superior, middle, and inferior lobe on your right side. What is this muscle here? This is your diaphragm right here. Just turn it on here. Yeah, there's your diaphragm right there. And then right here you can see, just two lobes on your left lung. So you have your superior and inferior lobes. So let's look over here and we'll see the same thing. So we have your thoracic cavity right here. So thoracic cavity is right there. Right here we have the pleural cavity. Here's a pleural cavity. Here is the mediastinum right here. Diaphragm, abdominal pelvic cavity. Okay, I think I've touched bases on everything there. Intercostal muscles right here in between the ribs. Right here, right here, right here. Okay, I think you're good on that. Let's move on to our last leg of the journey here. We're going to review this here. So we have the nasal cavity here, and then you have the nasal pharynx. Nasal pharynx right there, oral pharynx, and laryngeal pharynx. So nasal cavity, superior, middle, and inferior nasal concha. And then you have your nasal pharynx, oral pharynx, and laryngeal pharynx. This is your epiglottis again. This is your trachea. This is your esophagus. Okay? Now, we have the trachea right here. Bifurcation of trachea is right here. And then you have the primary bronchi right here and right here. Sorry, right here and right here. The right primary bronchus is bigger diameter than the left primary bronchus. The left primary bronchus is going to be longer, but more narrow diameter. Okay, and let's see what else. We have the lobar bronchus right here where it forks, and then we have the superior lobe. I've already showed you. So back here we have superior, middle, and inferior for your right, and superior and inferior for the left. Likewise here. Well, superior and inferior. Intercostal muscles are right here in between ribs. You have three sets of intercostal muscles. You have external, internal, and innermost internal. Here's your diaphragm again. Diaphragm is a parachute-shaped muscle. Okay, let's move on to the next thing here. So, right here we have the terminal bronchus. Notice that you have smooth muscles here, 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 which is going to be involved in constricting the bronchio and dilating the bronchio. Okay, so terminal bronchio here, and then we have what's next. This is the let's see what else. This would be the respiratory bronchio here, coming in to the alveolar sac, or well, I said that the wrong way. Coming into the alveoli. All this is the alveoli. All this is the alveoli. So, terminal bronchio, respiratory bronchio, and then you have the alveoli. All this right here. It looks like grape clusters. Okay, let's see where are we at now. I want to show you the blood vessels. So, we have the pulmonary arteries right here. They're blue. Pulmonary arteries are blue. And then we have the capillary right here, where you have the gas exchange. Right here is the alveolar duct right here. This is the alveolar sac right here. Now, these cells are very thin cells, and it's important to know they're very thin. They're going to be very important in gas exchange with the capillaries here. So, we see that CO2 is going to be dumped off right here in the alveolar sac, as we see here. And the CO2 is going to be gotten rid of. Now, oxygen is taken in, and we see that oxygen is in the alveolar sac, and we see that at the venule part of the capillary bed, we see that oxygen is going to be loaded from the alveolar sac into the capillary bed. And we can see that the venules, the pulmonary venules, are going to take back the oxygenated blood back to the left side of your heart, your left atrium. Okay? So I think we've touched bases of everything, just making sure. So remember, we have the pulmonary arterio, capillary, and then you have your pulmonary venule, which is carrying oxygenated blood back to the left side of your heart. So I think we're good. I want to do the last thing here, the tracing of blood. So I have a few more minutes left. Maybe my battery won't run down. So let me take you through everything here. And let's get started here. So we're tracing a drop of blood from the right atrium to the gastrocnemius muscle and back. So just going to go through some things here. So it's just like a GPS going to Nashville and back. Okay, to Pulaski. So we have the right atrium right here. So remember that you have your vena cava right here and right here. That is carrying deoxygenated blood, oxygen spent blood that has CO2 back to your right atrium. Then going to go to the right ventricle. So right atrium, right ventricle. This valve is called the tricuspid valve. When the ventricle contracts, as we see here, when both ventricles contract, that's going to increase the interventricular pressure, and that's going to push the blood up into the pulmonary trunk. This valve right here opens. This is the pulmonary valve. It opens. And then we have blood that's going into the pulmonary trunk. And then the pulmonary arteries, as we see here, they're blue. And then we can see right here that you have your pulmonary arteries. You have the gas exchange in the capillary bed and the Evader sac. You're getting rid of the CO2, taking in the oxygen. We see at the venule end of the capillary bed, we can see that oxygenated blood is going to be taken back via the pulmonary veins to your left atrium. So here is where the blood is entering the left atrium. So right here we see the bicuspid or mitral valve, what's left of it anyway. Maybe I should have got another heart. Wait just a second here. Just bear with me. Let me get it. Okay. So we have the left atrium, and then your bicuspid or mitral valve, and then your ventricle here, your left ventricle. Now, going back to this one, so this is your aortic valve here. So whenever the ventricles contract, it's going to push blood into the aorta and pulmonary trunk here. So on the left side, you have your interventricular pressure is going to increase. That's going to cause the aortic valve to open, and blood is going to go into the aorta. And then, of course, you can see that the aorta, there's going to be an arch here, and then we have right here, this is the descending aorta. This is your descending of thoracic aorta, going down to the abdominal aorta, common iliac artery, as we see here, femoral vein, and then we can see going down to the popliteal veins we see here. And then I don't have any pictures to show this, but we can see right here where you have the posterior tibial artery, and then you'll have smaller arteries and then arterioles that's going to be feeding into the gastrocnemius muscle. The arterioles feed into the capillaries, and then you're going to have gas exchange to drop off oxygen, pick up CO2, the cellular waste of cellular respiration. And then what's next is the venules coming out of the capillary beds of the gastrocnemius muscle or calf muscle. And then we have the posterior tibial vein, which we have a little bit of right here. Yeah, right there. And then the popliteal vein is further up. And then your femoral vein. And then we have the common iliac vein. And then the vena cava. And then back to your right side of your heart. Let me put this back up here. Back to the right side of your heart. Ready to do this again. So it's just like a trip to Nashville and back. So, to Pulaski. So, anyway, that's just sort of to demonstrate the tracing of blood from the right atrium to the gastrocnemius muscle or calf muscle, and then back to the right atrium again. And this concludes this presentation on the cardiovascular and respiratory models.